certain analgesics for pain, but they're not really cured of the disease. And then cancer therapy can also be just palliative for some patients. They may be taking certain drugs to relieve they may be in a lot of pain or discomfort, or they may have some kind of chemotherapy, but it's not really curative for the patient. Okay, so that's the steps in patient care that we finished up. So let's go next to, and then of course, just after the patient's treated, the patient's going to be ideally reevaluated. And you're going to see this with your patients too. You're treating patients that have gingivitis and periodontitis, and you're going to have set up treatment plans and treat them. And when they come back we have what's called a periodontal reevaluation, or if they come back for their recall or continuing care, you may see that your treatment cured the patient or helped the patient. Okay, so now on to the classification of diseases, and I want to review briefly the different types of systems of classifications. Diseases can be classified topographically. This is more like the system. For example, disorders of the GI tract, disorders of the respiratory tract, diseases of the blood, those are skin disorders. Those are all examples of a system. And a lot of times courses are set up that way, and it's diseases according to each system. And it's actually called a systemic pathology class. Or it could be more just on the anatomic, the specific organ or tissue, liver diseases, diseases of the oral mucosa or the oral mucous membranes, diseases of the jaws, diseases of the teeth. That's another way to classify diseases. Now, the book that you have follows an etiologic classification by causes. And the preview of the different diseases to you, I'm going to present to you as an etiologic survey, like groups of diseases based on their etiology. But it could also be on the nature of the disease process. For example, within the course, you're going to hear an anatomic area would be diseases of the salivary glands, and you're going to hear they're going to be divided into what are called neoplastic and non-neoplastic. This is a classification, a subclassification based on the disease process. Neoplastic, very simply, is related to tumor formation. So tumors of salivary glands versus non-neoplastic diseases that are not related to tumor formation. Also, based on the clinical appearance, when we're going to have a pretty long section that covers diseases of the oral mucous membranes. And they're going to be divided up in terms of their clinical appearance. We're going to look at red and white lesions, pigmented lesions, ulcerative, and they're called vesicular and bullous lesions. I know those sound like big words, but they'll make perfect sense to you as we get to that. And I've just shown you how these classification systems are overlapping, how you can combine them to to classify the different diseases. Okay, so with that, this is just like a preview of different types of diseases we're going to talk about based on their etiology or based upon their causes. Okay, so first of all, there are infectious diseases, and infectious simply relate to that they're caused by pathogenic microorganisms. and the oral region is affected by various viral, fungal, and bacterial infections. Okay, so here's a case of, again, a common viral infection, herpes simplex 1. This is a primary infection with it. Often patients have recurrent ones. That's they have recurrent cold sores or fever blisters. Here's one healing on the lips, and some patients have them intraorally. Here's an example of oral fungal infections, the different presentations of candidiasis. I already showed you how the example of denture stomatitis. I showed you the baby with thrush. Here's another example of thrush on the soft palate. Here's an example of erythematous candidiasis, or that appears as a red lesion. Okay, so candidiasis is a fungal infection that we're going to be studying under red and white lesions because that's the appearance that it has. And then there are different bacterial infections. This is just an example of an STD. This is actually syphilis that was transmitted through oral sex, and this is a what's called a chancre in syphilis. You're going to learn that different bacteria are going to cause caries, and different bacteria are going to be involved in the different abscess formation. So this is a periapical abscess on the x-ray, and that's the same patient who had the sequela that it spread and formed a facial abscess. And in perio, you're also going to learn about the different bacteria that play a role in triggering a host response that is destructive to the periodontium. Okay. Your book has an extensive chapter on developmental conditions. Some of them are more rare, and they're beyond the scope of the course, but they are a significant piece and they can range in their severity. We can say something as minor as having a peg lateral is still developmental. It's an anomaly in tooth development. So just to emphasize that developmental is related to disturbances in the pattern of human growth. It can occur in the womb prenatally and be present and show up at birth as this severe developmental anomaly. This is a baby who has bilateral cleft lip with cleft palate. Or they can show up more later on in life. And I want to make the distinction that they're not always congenital. Congenital simply refers to present at birth. Okay, so developmental anomalies may or may not show up at birth. Here's a simple cleft lip on the baby's right side that shows up at birth. Here, this is not a baby, but this was a cleft palate that was present at birth and never was surgically repaired, wasn't treated. Okay, and then we say that we know that our permanent lateral incisors we're not going to see them clinically at birth, but when they never develop, they're described as being congenitally missing teeth. And besides third molars, maxillary laterals are the next most common tooth that are congenitally missing. Now, an example of a developmental anomaly that doesn't show up at birth are tori. Okay, tori are not typically seen at birth, and they'll start, these bony protuberances tend to appear at adolescence and grow even in young adulthood. Lingual varicosities are more common in older patients. You'll see them more frequently in a geriatric population, not a younger population, but they are examples of deviations that occur during our normal pattern of growth. Now, developmental is a very large group. I showed you how a minor peg lateral versus a severe bilateral cleft lip with cleft palate, but I also want to point out that the etiology of developmental anomalies varies. Many of the developmental diseases are genetic, okay? They're related to involved genes or chromosomes. And sometimes we'll use the term that they're inherited, that they're passed on from a parent to a child, or we can say that sometimes they're hereditary or they're familial, they run in families. There are even some conditions that they see tend to run in families, so they have a familial tendency, but a specific gene has not been identified as causing it. Okay, so genetic, I just want to emphasize, is disturbances involving genes or chromosomes. They can be hereditary or familial, or they can be a result of a spontaneous mutation. For example, a Down syndrome baby, that's just like a mutation in the chromosomes. It's not necessarily passed on from generation to generation. Okay. Another thing we talked about in oral, so I'm getting some background. Somebody may have a mic on. I'm getting some background. Thank you. Some developmental anomalies may be related to factors in the environment. We talked about teratogens briefly last semester in the embryology unit. There are different things that increase the likelihood of a congenital defect or a birth defect. For example, again, syphilis, a microorganism. Syphilis, if a mother has syphilis when she's pregnant, it can be, the baby can be born with congenital anomalies. Or we'll also hear that developmental anomalies are multifactorial. This is when they're kind of all bundled together that, well, it could be a combination of genetic and environmental factors. How much is genetic? How much is the environmental push involved? Isn't always clear cut. It seems that most cleft lips and cleft palates fall under this multifactorial. There may be a genetic predisposition. Let's just say it's a very weak one. It would take something in the environment that's very strong to trigger it. For example, severe stress. Whereas somebody else may have a strong genetic tendency that, like, there's a history in the family that there have been babies born with clefts before. And so there's this strong genetic tendency, and it may just require a little environmental push, right? So I wanted to give a couple more examples. This is definitely genetic. Sickle cell anemia is a genetic disease. It's passed along with a specific gene. And there may be some oral manifestations. We're not going to worry about that right now. Hemophilia is definitely a genetic disease, where these patients are lacking certain clotting factors, so they're prone to abnormal bleeding. They actually have to have what's called replacement therapy. They have to have blood transfusions for replacement of the clotting factors that they're missing. I've already mentioned Down syndrome, which this is a genetic disease. This is more like that. What happens is during, the meiosis process, the chromosomes dividing, there's an extra piece of chromosome number 21 that's occurs and results in the manifestations of Down syndrome. And we're going to be going over some of the oral manifestations, like they often have what's called macroglossia, a very large tongue. Okay, and then again, as I mentioned, that peg laterals tend to run in families, which suggests a genetic basis, although they haven't found an exact gene location for peg laterals. And I remember before we actually had a student named Peggy, and she had bilateral peg laterals, but she had crowns on them. And tori, tend to run in families. One of our graduates, she had mandibular tori, and many of her family members had just these gigantic tori in the mandible. Like I've never actually never seen any as big as those in her family. Okay. There are genetic diseases that affect the teeth as well. Here's a disease called amelogenesis imperfecta, that the ameloblasts do not produce normal enamel. And there are many different types of amelogenesis imperfecta. In contrast, I mentioned congenital syphilis as an environmental factor that can cause developmental anomalies. Another example of a environmental factor is how excessive fluoride can affect tooth development. When there's excessive fluoride taken in by the individual during tooth development, the patient can end up with white spots or even yellow and brown spots on the teeth, or have a condition that's called fluorosis. So fluorosis is actually a developmental condition related to environmental factors.
Is there a specific age when we're talking about fluorosis development?
Oh, I'm just giving you an example of this is just some kind of intrinsic stain, and the conditions is called fluorosis. Fluorosis, if it's known to be related to excessive fluoride ingestion. Okay, and here is an example of congenital syphilis. They have abnormal incisors that develop. They're said to have like a sharp incisal angle that resembles screwdrivers, so they've been referred to as screwdriver incisors. But the bacteria that causes syphilis affects the normal tooth development. So that's an example of another environmental factor. Another one is when tetracycline is ingested. Again, this is not really seen as much in your generation or younger patients, because other antibiotics are used besides tetracycline, but we'll still probably be seeing tetracycline stain in third molars, because some teenagers take different kinds of tetracycline derivatives for acne. And I've already just mentioned the multifactorial nature of the cleft lips and cleft palate. Most of them are not part of just solely genetic diseases. It appears to be a combination of genetic and environmental factors. And then I just wanted to mention, sometimes it's not clear, something is developmental, but it's not clear at all if it's genetic or environmental, but there are patients that develop a shortened lingual frenum closely attached to the tip of the tongue, and they don't really know why this occurs in some patients. Okay, so I've kind of shown you some things that would be more common, less severe. The most severe thing that comes up in our discussion is really the cleft lip and the cleft palate. All right, so again, just to summarize this section is that all genetic diseases are developmental, but not all developmental diseases are genetic. You know, I've shown you examples of things in the environment that can affect our normal development, like excessive fluoride, congenital syphilis, caused by the microorganism Treponema pallidum. Another summary statement we can say is all congenital diseases are developmental. In other words, all diseases that show up at birth are developmental in nature, but not all developmental diseases are congenital. And I showed you the common example of toride doesn't show up usually until adolescence or young adulthood. Okay, let's look at degenerative diseases. And these are diseases that are going to be more discussed more commonly in a systemic pathology kind of course. But just to understand what this is, if you look at the definition, it's just related to the deterioration of tissues, organs, or body parts. So we can say almost every system or organ can be affected by a degenerative disease. For example, there can be, for example, with a degenerative disease of the joints is osteoarthritis, or a degenerative disease of bones that's more common in women. Women have to take certain precautions sometimes to prevent this, but osteoporosis. There are different degenerative diseases that affect the liver, the brain. There's Alzheimer's disease, there's Parkinson's disease, there's many different degenerative diseases. Hardening of the arteries, or atherosclerosis, that's classified as a degenerative disease as well. So I could, name quite a few. We're not going to be studying TMJ disorders in this class, but an example of an oral degenerative disease would be osteoarthritis of the TMJ area. Over on the right here, this is a normal condyle. In the middle here, look how worn down that condyle is. There's just been degeneration of the bone there over time. Mrs. Simmons, osteoporosis, often affects the femur area, the lumbar region of the skeletal system, but it can also affect the jaws and play a role in tooth loss for some patients. So those are the oral examples. Okay. Let's look next at the group of diseases called nutritional diseases. These are related to a deficiency in nutrients or an excess of nutrients. Again, I mentioned the real common one, women and children are more prone to iron deficiency anemia, so they don't get enough iron in their diet and can develop this type of anemia. Iron's needed for proper hemoglobin synthesis in our red blood cells. It affects our oxygen carrying capacity in the body. Scurvy is a vitamin C deficiency that can, affect collagen synthesis, and there's often gingival inflammation seen as part of a scurvy picture. So usually, and then you hear about these weird diseases related to some other vitamin B deficiencies like berry and pellagra. I don't know if you've ever heard of those from your nutrition class, but we're not really going to get into much into the diseases related to deficiencies of certain vitamins and minerals. I just wanted to show an example of sometimes too much of a nutrient can be toxic, and there's a condition called hypervitaminosis A, which is too much vitamin A. Vitamin A is metabolized by the liver, and if you get too much, it you end up having like beta carotene in the skin, and the skin can actually turn an orange color, and the patient can have irritability and other manifestations with this. But I'm just giving you an example with too much of a good thing can be detrimental to one's health. All right, metabolic diseases. Metabolic diseases are related to a disease that's related to a disturbance in our normal metabolism, or what we call our biochemical reactions in our body. The best examples I can give this are those diseases that affect our endocrine system, our hormones. All the diseases related to deficiencies in hormones or excess hormones are classified as metabolic diseases. In women, it's common to have hypothyroidism, an underactive thyroid. And to treat this, women are placed on artificial kind of hormone replacement therapy. You may have heard of Synthroid before. At the other end, a person can have hyperthyroidism, an overactive thyroid gland. It can work both ways. And there are some metabolic diseases that have oral manifestations that we will be discussing in this course, or diabetes is one of them, but the focus is going to be in your periodontology class and the impact that diabetes has on a patient's periodontal status. Patients with diabetes are prone to periodontitis, because just in general, they're more prone to infection. And the more severe the perio disease is, it can actually impact on a patient's diabetic control. So that's a good example of the interplay between systemic disease and oral disease. But again, I'm going to emphasize it's going to be covered extensively in your perio class. An example in this class is there's a disease called Addison's disease. It actually affects the production of steroid hormones by our adrenal glands, the adrenal cortex. And one of the unusual manifestations of it is melanin pigmentation of the oral mucosa. So here's an example, another example of an underlying systemic disease that may have oral manifestations. the pigmentation is not a problem. What it is the impact the steroids have. And it's really a deficient, if I said extras, I'm not sure if I said extra steroid hormones, but it's a deficiency in your steroid hormones. So I apologize if I said that wrong.
Quick question. Is that also the melatonin pigmentation in the gingiva?
It can, yeah. It can affect right there, this isn't a good photo of it, but it can, so if you weren't aware if a patient had pre-existing melanin pigmentation of the gingiva, and assumed it was pigmentation of the gingiva, it could be not misdiagnosed or missed.
Uses its deficiency to
This is just an example of an underlying metabolic disease and a deficiency in our steroid hormones, our corticosteroid hormones that are produced by our adrenal glands. If you remember, they're located on top of your kidneys.
Yep.
Okay, neoplastic diseases. Okay, this is this is going to make up a very large section in our course. And it says it's neoplastic diseases are characterized by uncontrolled abnormal cell growth that leads to the formation of benign or malignant tumors. So we're talking about any kind of diseases in which tumors form, specifically benign ones or malignant ones. And as you know, malignant tumors are forms of cancer. And this is going to make a large group in our class. Okay, so this is just showing you an example of some of benign neoplasms that can show up in the oral cavity. The most common one is the benign papilloma. This is shown in the oropharynx area. And I've shown you some examples of oral cancer. Here's one that doesn't look as severe, and here's on the right-hand side is a well-advanced one. Okay, immunologic. We're going to be looking at this section closely as well. And these are diseases that relate to abnormal immune responses or immune mechanisms. And we're going to see that some of these are related to a deficient immune response. For example, as seen in an AIDS patient. We may see oral manifestations related to an overactive immune response. A good example of these are allergic reactions. Our body goes overboard against things that are actually relatively harmless, like sometimes flavorings in toothpaste or just your everyday pollen in the air. A misdirected immune response is one in which the immune system attacks our own tissues. These are the autoimmune diseases. And unfortunately, there are many different autoimmune diseases in our body, and many of them have oral manifestations. For example, lupus. The long name for it is lupus erythematosus, is an example of an autoimmune disease which may have oral manifestations. And then there are immune responses that are not completely understood. So their cause is clumped under immunologic, but it's classified as being an unclear. They see that there's certain cells in the immune response in the lesion, but they're not really sure what's happening entirely. So we'll be looking at this. So here's the example of oral manifestations of full-blown AIDS related to a deficiency. Here's an allergic, these ulcerations on the tongue here are related to a drug allergy. And here's a patient who has lupus. In addition to some oral lesions, when you do your extraoral exam, they may have this kind of what's a rash on the skin of the face. It's said to look like little butterfly wings, so it's been named a butterfly rash of the face. It doesn't always, sometimes it just looks like they just have, like their whole face looks kind of red or like a red rash on it.
Does it also extends to the eyes in some cases? Like it goes around the eye?
It could, yeah, it looks like it's up here a little bit, but it's primarily in this area. And then what falls under something that is pretty common in the general population is aphthous ulcers or canker sores. This is said to have an unclear immunopathologic mechanism. This is not a severe, in most patients, it's not a severe condition, getting canker sores, but in some individuals, it's very severe. Okay, so we'll really be getting into quite a few immunologic diseases that fall under this category. Okay, psychogenic, disease linked to emotional factors. So sometimes patients get hives as part of an allergic response, but some people can get hives from stress. People can, there's a skin condition that's, again, it's not clear cut what the etiology is, and it may be more that the stress is the trigger or the predisposing factor rather than the exact cause. But rosacea is very briefly an adult kind of acne. Or, you may find yourself without having rosacea that if you've been stressed out, your face breaks out. Other things could be like acid reflux can be triggered by stress, ulcers in the GI tract. Okay, geographic tongue, which is one of the more common conditions seen in the general population. Again, they say that the etiology is not known, but it may be flare-ups or exacerbations of it may occur during stressful times. I know we've had some students with geographic tongue, and when they were doing their checkouts in preclinic or during finals time, that it would appear. Because this can appear and disappear and reappear in other areas, or it can get enlarged. It can be constantly changing. And then there is also this disease that's referred to as lichen planus that may be related to stress. But again, here's another example where these categories of diseases are overlapping. They found this in this disease, there's an unclear immune response, but it can be exacerbated or flared up by stress. So again, what's really the cause of it? The stress may be just one of those things that predisposing factors that increases the likelihood of it manifesting. This is also it's not unique to the oral cavity. The patients that have this usually have skin lesions too. Okay, getting to the end here, iatrogenic. These are diseases caused by health professionals while rendering health care. So let's say here's an example of a real simple thing that a hygienist could do by just using a saliva ejector and having it on and having it suck up the delicate floor of the mouth tissue. I showed you this before in oral histology, and this created this blood blister called a hematoma. So this lesion was induced by, a hygienist while rendering care. Another example would be a lot of these things are, we could say in the hospital setting are nosocomial, but not following strict infection control procedures. That could apply to dentistry too. Another good example for dentistry is if a dentist is doing a cavity preparation and sometimes it's not his or her fault because there's not very much dentin left anyway, and it may expose the pulp, but the dentist could have poor technique and cause a pulp exposure. That would be iatrogenic. There's a fine line between if that's really caused by the dentist or not, like I said, because the caries could be close to the pulp in the first place. Another example would be a doctor prescribing the wrong medication or not looking at the chart and seeing that the patient's allergic to penicillin and prescribing a patient penicillin, and then the patient has an anaphylactic reaction. That would be an example of something that's immunologic, but also iatrogenic. Not when patients have a recent artificial joint replacement, like a knee replacement or a hip replacement within 2 years, and the patient isn't pre-medicated. That could cause an infection in the patient's artificial joint area. Okay. And here's another kind of simple one too. Like if you were, sometimes you're going to use a cotton roll to isolate an area. For example, when you're applying sealants, here's a iatrogenic injury called a cotton roll ulcer. The cotton roll stuck to the epithelium of the gingiva, and the clinician did not wet the cotton roll. So some of these can be minor kind of injuries to the patient, or they can be actually life-threatening injuries to the patient. Or here's another, we're not as apt to have this happen now, but as you know, many patients have latex allergies, and we have pretty much eliminated latex in the clinic. We don't have latex gloves. We don't have latex in the prophy cups. But again, if you wore latex gloves and worked in a patient's mouth, you could create this oral allergic reaction to latex. Okay, idiopathic. Here's the term idiopathic simply means that it's a disease with an unknown etiology. And there are a plethora of different diseases that can fall under this. Like I've already mentioned, like they don't really know the exact cause of rosacea. They do know that certain things like caffeine and stress can trigger it, and just Bell's palsy, you know, that affects the motor root of the facial nerve. Sometimes there's not a clear-cut cause for it. There's that disease I showed you with the target lesions, erythema multiforme on the hand, that's pathognomonic. Sometimes that's related to allergies, but sometimes there's no clear-cut cause for that disease occurring. Hypertension, there's different, is classified as idiopathic, having 90 to 95% of the cases having no known cause. But again, using hypertension as an example, there are different risk factors that relate to it. When you're older, your race, genetic factors, does it run in your family? Are you overweight? Do you sit around a lot, have a sedentary lifestyle? Those are all risk factors, but overall, there's not like one exact cause why people develop hypertension. Here's the case of the Bell's palsy when there was not a known cause for it. The paralysis of the muscles of facial expression is related to the motor root of the facial nerve, as I mentioned. There is a disease called ITP where a patient gets a deficiency in his or her platelets and they're prone to bleeding. This can be minor or very severe. Another oral example is what's called idiopathic internal resorption. I mentioned to you sometimes unknown triggers stimulate clast cells. And here's an example where clast cells inside the pulp are stimulated to resorb the tooth from the inside out. And this case was suspected to be related to orthodontic tooth movement, but it wasn't definitely proven. So most internal resorption is clumped under idiopathic. All right, so we're going to also talk about this disease called cemento-osseous dysplasia. It's a non-neoplastic, meaning it's not related to cancer, affecting the jaw bones. But the exact cause of it is not known, and it's very common in postmenopausal African American women. So I think I've given you a wide a preview of the different disease categories that we'll be looking at in the course. I just wanted to just show you a couple. Like I mentioned the other classification system, but like this, we could say diseases of the soft tissues, diseases of the hard tissue. So I already mentioned we're going to be looking at mucous membrane pathology, the oral mucosa, and there's also some bone lesions of the jaws, we could say. And then I mentioned that we're going to study salivary glands, and we're going to look at non-neoplastic conditions and the neoplastic conditions related to tumor formation. And then we're going to subdivide the lesions that affect the oral mucosa. And this is an example of a survey of red and white lesions. A variety of white lesions we're going to be looking at. So you'll learn how to look at, well, what are all the lesions that show up white, and what other information do I need to distinguish them to come up with that differential diagnosis. Okay. I think we'll just go ahead and stop there because we're not going to finish the next part. So we'll finish up this topic next week, and then also start the next topic, inflammation and repair. I like the group that's going to have the 2 sections in Wilmington that are going to have Rad Lab to just stay on for about 5 more minutes. Okay, if everybody else would go ahead and log off. Does anybody have any questions though?
When is our first quiz?
I announced that it's going to be on Wednesday, January 27th, on just the introduction to pathology that we'll be finishing next week.
Okay, thank you.
Sure.
Thank you.
Thank you. Have a nice day.
All right, thanks. You too.